Did you know that 1 in 10 babies is at risk for having feeding difficulties due to lip or tongue tie in America? Well, that's not one of the first things that's on our mind when we are new parents. No, we are just elated about being new parents. We are enamored and making sure that our baby is strong enough and they can hold their head up high already. Or they're so smart, they can communicate with all the oohs and ahs and let us know all their little expressions. Well, I was definitely one of those moms that was excited about all the movements. However, I was also a mom that struggled with breastfeeding my baby. I was so stressed about failing at breastfeeding that I kept wondering, am I doing this right? I had forgotten that in my professional life, as a pediatric laser dentist, I help take care of babies that have feeding difficulties due to lip and tongue tie every day. The American Academy of Pediatrics recommends that all babies are breastfed exclusively for the first 6 months of life. And they continue to breastfeed for up to 2 years of age or beyond, if possible. However, the CDC reports that 60% of moms cannot breastfeed the amount of time that they intended to. On the other hand, we have Mayo Clinic that reports 3 million cases of ties in America. Infants that have lip or tongue tie are prone to having feeding difficulties. And when the ties are removed, their symptoms are reduced or resolved. You guys may be wondering by now, what are ties? We are all born with a band of tissue inside our mouth called a frenum. If you take your tongues and sweep around inside your mouth, try to go under your upper lip, the lower lip, try to reach the very last tooth inside your mouth with your tongue, you may even feel how nice and stretchy and wide, flexible that frenum needs to be. When a frenum is too thick or too tight or too short, it becomes a tie. Let's do a check. And we'll try to see if the frenum is working well for all of you. I know this is not one of the hobbies that everybody signed up for. I will break it down in 3 steps. Close your mouth, swallow your spit, and take a deep breath through your nose. Now, when you did that, did your lips stay close? Did your tongue squeeze against the roof of the mouth while you swallowed your spit? Or was your spit noisy, like you had to take that gulp of air that was sitting in your mouth because you were mouth breathing? After our little exercise, if any of you have questions about your mouth and your swallow, I invite you to bring this up with your dentist. But otherwise, spotting problems with someone's swallow or mouth function, whether they're an infant or an adult, affects how their entire life unfolds. While the impact of ties is enormous on breastfeeding, it goes even beyond that. Babies that grow up with undiagnosed or untreated ties continue to have to keep working around them. They may learn to adapt sometimes, they may compensate, but sometimes they just struggle to meet your normal growth and development milestones. It can look like gagging, coughing, choking on textured foods. It can be speech clarity concern. It can become more caries because, remember the exercise, their tongue can't reach everywhere inside their mouth. They may be mouth breathing, bedwetting beyond age 5, and plethora of issues that are still actively being researched about impact of tie. Let me tell you a story about this one mom that found me in her quest for answers. After struggling for many years, she had a baby. cute little butterball of love and had that perfect latch. However, within 24 hours, she found out that he had lost more than 10% of his birth weight. She was caught completely off guard. Nothing could have prepared her for the sharp pain, blisters, and bruise that came from trying to feed her baby. The baby, on the other hand, was fussy, crying at the top of his lungs, noisy feeds, making the clicking, gulping sound, or falling asleep exhausted after just a couple of minutes of chomping on her. Her goal was to exclusively breastfeed throughout maternity leave, but things did not improve. Round-the-clock pumping, bearing the pain, bottle feeding were not even enough to get him back to his birth weight for his 2-week pediatrician checkup. Finally, a lactation consultant at one of the visits mentioned there might be an issue with the baby's mouth and referred her to me. As I was listening to her story, I could already spot the 3 biggest red flags that are related to feeding in babies for oral ties. First, mom in pain while feeding beyond the first week after birth. 2, baby is fussy while and after feeds. They should be calm and relaxed after they feed. And 3, feeding is noisy with clicking and gulping sounds. As I sat down to evaluate his mouth, I could see that he had all the classic clinical signs, and his anatomy and how he was sucking on my finger explained his symptoms. He could not make a seal with his lips around my finger, so he was gulping the air. As he was gulping the air and he needed to burp out that extra air, he was uncomfortable and fussy. His tongue could not reach the roof of his mouth to create a good seal to suck. So he was using his jaw to chomp, causing the pain for mom, and he was using all his muscles of his cheeks and his jaw to use all his might to squeeze the milk out of the breast or even bottle, rather than with the seal, making that wave with his tongue to swallow nicely. He was using more calories than he was gaining from his feed and having the weight issue. As soon as I was able to marry these two, the anatomy and his symptoms, we had our diagnosis. He in fact had a lip and a tongue tie. I was able to take care of him with a procedure called laser frenectomy. And within a week or so, after she had worked closely with her lactation consultant, baby was doing much better. He was not fussy during feeds and after feeds. He was a happy baby, no more pain for mom, and even his pediatrician noticed that his weight gain percentile had improved. But you know why this story resonated with me and why I chose to share this story with you guys today? Because I felt all the pain, the guilt, and the judgment while I was going through my own stressful breastfeeding journey. Even as a healthcare provider, I needed my angel lactation consultant to bring it up. Until then, I didn't want anybody to know who I was. I was having such a hard time with that postpartum time frame. I was like, tell me everything. And she goes, aren't you Dr. Rashida Jaju? We send these babies to you. Do you think there is a tie in his mouth? And that was the aha moment for me. 2 things happened. 1, I realized there is a real reason why my baby is struggling. And 2, I can help it. That was the reason that I felt like I need to share this message. And as we say, this idea worth spreading. In all my years of education as a dental student at Harvard School of Dental Medicine, a resident in advanced pediatrics, and a fellow in neurodevelopmental disabilities at Children's Hospital in DC, If I was not exposed to impacts of ties on babies, many doctors who might be taking care of their patients having some of these difficulties may need to learn about it by continuing their education further over the years as well. So let's get the right message out there. Parents, trust your instincts. If your baby is having more feeds that are stressful and unhappy versus joyful and calm, then let's get the baby's mouth checked out. Let's free up moms from unnecessary pain, guilt, and postpartum judgment. If you see the 3 red flags in your baby, pain while feeding beyond the first week after birth, 2, noisy feeds with clicking and gulping sounds, or 3, baby fussy during or after feeds, let's help moms recognize these things too. And providers, if you have a patient or a client that is reporting these issues, let's try to encourage them to seek out the right specialist and the right support so that you have checked off all the boxes to help them arrive to the right diagnosis before providing emotional support for some of the transient issues of the newborn. So that more of the 3 million babies, or the parents of those 3 million babies that are born in America each year with ties, can go back to reporting how strong their baby is and how smart their baby is, and know that they are doing parenting right. Thank you.